The Surgical Information Management System was a solution we had available at Health Sciences Center. It helps provide the tools that surgeons need while they're doing their surgeries. It helps capture information about the events that happened during the surgery, and it helps collect the health information of the patients while they're having their surgery. We took that solution and we extended it out through the rest of the WRHA, so all the operating rooms now are using the same system. So they take the patient information, they put it into the SIMS, and they determine which procedures they will need to do. When they've determined the procedure and the surgeon that will be doing the procedure, they will send a card out to the medical processing site, and they will provide the right instruments. They will also make sure there's the right staff complement for the surgery, and they will then have the ability to manage and to collect information about that surgery as it progresses. The initial challenge we had was the fact that the facilities all practiced in their own manner. They had different ways of doing things, they had different ways of collecting information. We needed to get them to come together and collaborate and come up with one approach. We had people who were using the old system, but they had used it in a certain way, and we were changing that for them. So we needed to convince them that the changes were for their benefit. And we also had people who had never used the system, and so we had to bring them on board and help them understand how they could use a new system and how they could interact with it effectively. Well, the project adopted a very strong organizational change management process, making sure they connected with the leadership at each of the facilities, making sure they consulted with all of the stakeholders that were involved so that people understood what was happening and when to expect things to happen and when they would be impacted by those changes that were coming their way. We built training classes. We trained their trainers that are in their program at their site to train their own users, and that is also another way to ensure that they're speaking the same language and they understand, and they're also showing them what they need to do in order to work in the new world. I think, quite honestly, the biggest learning that I get out of projects like this is the need for transparency, the need to be clear about the challenges that are being faced, and the need to work with everybody involved to address those challenges. Without that, you can't be successful. Certainly, in the second phase of the project, bringing the people who had been involved in the first phase, understanding what we had missed along the way, and making sure that they gave us the best information and they helped us to build the plan for the second stage made it much more effective and much more successful. We have a standardized approach now to scheduling. All of the facilities, we know how many operations are happening when surgeons are operating. They now have a consistent set of information available to them, and they also have a consistent set of tools in the system, so they're available wherever they go, and they can provide the same care to patients regardless of where they're doing the surgeries. Now we have consistent menus in place for them to follow when they're doing their surgeries. We have consistent data we're collecting from the surgeries so that we can go back and reflect on the outcomes based on what information has been collected. We now have patient, family-facing status boards that they can see in the waiting room, and they can follow the progress of the surgeries. They're not anxious. They can understand what's happening without having to go and find somebody to ask questions from.